the objectives of this session, and second, to introduce my colleagues with me from both WHO and the Ministry of Public Health involved in the mass gathering preparedness aspects of the World Cup 2022. My name is Rayana Bouhaka. I'm the WHO representative in Qatar. I have recently joined as we established the office in the middle of 2022. As Qatar has been planning and preparing ahead of time several years ago on this main event and project, we with WHO and FIFA and the Ministry of Public Health joined together for a partnership that has, of course, several objectives and areas of concentration. But one of them was to make sure that we all ensure, especially after the pandemic, a healthy mass gathering and a safe event for all. And in this respect, the project that had been started 3-4 years ago, and which has other elements related to the promotion of health, including nutrition, sports for health, and also communicating and promoting healthy lifestyles, has also a very big important part on mass gathering, as we bring in for the first time in such a big dimension many people around the sports events in football and in celebration of successes around the COVID-19 response and reduction. However, there is a lot to do in preparedness, and there is a lot to do in mass gathering that we are still learning from. So part of this project is also to share the lessons, prepare better for other sports events, and ensure that from the word on any other sporting events will benefit from all the preparedness and all the good procedures and processes taken on during that World Cup 2022. I would like to introduce my colleagues who will be each one presenting several components and aspects of the mass gathering preparedness of sports events. Dr. Mohammed Al-Hajri may be joining us if he finished his meeting on time, and he is the Director of Emergency Preparedness in the Ministry of Public Health in Qatar. Dr. Suha Al-Bayat is the Head of Vaccination in the Department of Health Protection and Communicable Disease in the Ministry of Public Health in Qatar. Dr. Dalia Samhouri is the Program Area Manager of the World Health Emergency Program in WHO Eastern Mediterranean Regional Office. Dr. Liviu Verdasco is the Unit Head of the Country Simulation Exercises and Reviews in WHO Headquarters in Geneva. And Ms. Amaya Artaskos, if I pronounce it bad, I apologize, Amaya, with my pronunciation. Technical Officer, Mass Gatherings, WHO Headquarters, Geneva. I thank them all for their contribution, and I pass on the presentation or the discussion to our first panelist. I think Dr. Suha, please go ahead.
May I jump in, Dr. Rayana? Hi.
Please.
We would actually like the greetings to you all from the EPI-WIN team in the headquarters, and thank you for attending this webinar and for sharing the experiences with us in the planning and preparedness for such a massive event that it's very close. Every day is closer and closer, and we are looking forward to having a really healthy and safe World Cup. Having said that, the first question goes to a dear friend and colleague, Amaya, and it's more about WHO has previous experience of assisting countries for different mass gatherings and events. How does the WHO support countries, and what are some experiences and lessons learned from other sport events like Olympic Games, especially in China and Japan? and what WHO's recommendations being taken into consideration as part of preparedness for this year's FIFA World Cup. So thank you, Amaya, and over to you.
Thanks a lot, Julie, for your questions, and also for inviting me today to this webinar. Well, we know that more than 1.4 million fans are expected to visit Qatar from across the world to experience this tournament, starting only in 20 days from today. And we know very well that due to large numbers of people coming together for a period in time and close proximity, there's always a potential to increase the risk of transmission of communicable diseases. We have seen that, especially in the last couple of years with COVID-19, but of course, there's another number of risks, such as, for example, risk of crowding. Only in October, we saw the sad incident in Indonesia with an stampede that caused the death of 125 people. Another risks, such as risk of attacks, this year, for example, being the 50th anniversary of the terrorist attack during the Munich Olympic Games. And moreover, we know that if a disease outbreak happens during the period of an international mass gathering such as this one, can really become an international super spreading event. But there's not only bad news, there's really good news about mass gatherings and hosting mass gathering events, because we know as well that they provide this opportunity to strengthen both emergency and routine systems in the host countries. And this can benefit countries such as Qatar, in this case, long after the event. Responding to your question, how we do in mass gatherings and how we tackle these big events, we recommend the model basically based on the best practices from the last couple of years, and is to follow all hazards risk-based approach. This risk-based approach has 3 steps. The first one being risk evaluation, where we identify and quantify the baseline risk associated with events. Risk mitigation, so we apply based on this risk package, in this case of precautionary measures, aim at decreasing the baseline risks. And finally, and very importantly, risk communication, where we disseminate information proactively on these precautionary measures adopted, and we explain why we want to use them. The last 2-3 years now, mass gatherings have become this sort of innovation hubs, and we have a lot of lessons learned, as you mentioned. We observed during the Winter and the Summer Olympic Games, during Euro 2020, the UEFA Championship, African Cup of Nations, and many others. So we know very well that zero risk does not exist, and therefore mass gatherings should never left unmanaged or poorly managed. And this is why it's so important to regularly conduct this risk assessment that I previously mentioned when planning for an event. The last couple of years as well, we've been working with colleagues in Johns Hopkins University. They've been monitoring the use of risk-based approach, and we are happy to report that there's been a huge increase of the taking into consideration this risk-based approach in countries and also by event organizers. We learned as well in the last couple of years that planning considerations should not be limited only to the event itself, but also encompass, really important, the social context in which the event takes place. For example, we know that even the organizers in Tokyo 2020, Beijing 2022, also Euro 2020, they successfully enforced really strict and safe protocols within the event venues, promoted community adherence to such protocols outside the official venues. Proved to be sort of a critical challenge, and therefore planners must pay close attention to public health and social measures, again, outside these sort of event venues. Transportation is a key thing as well between the events, accommodation, and of course, when discussing about site gatherings. So therefore, ensuring that we have in this open and transparent planning environment with all relevant stakeholders, with the football players included, spectators, hosting community, organizers, but also with different key sectors such as health, security, business, and others are really key. We're very lucky again that we've been using all these lessons learned and best practices with colleagues in Qatar for more than 2 years, 3 years now that Rayana already mentioned. So some of the activities that we completed in collaboration, of course, with colleagues in the country and in the region and colleagues in Qatar are this risk assessment previously mentioned, after action review and simulation exercises. I'm sure that my colleague Livio will elaborate a bit on this. Completing training activities on mass casualty management, support to the emergency medical teams, as well as many others. Currently, we are supporting experts in Qatar because we are, again, starting in 20 days with the championship with the situational reports. That is sort of a snapshot of the key public health information that happened in the previous 24 hours. and this will be done on a daily basis. And maybe quite importantly as well to mention that, of course, in the last couple of years, there's been this COVID pandemic, but also there's been this disinformation pandemic. There's been a lot of fake news, there's been a lot of rumors, and this has had a negative effect on many individuals. Therefore, an activity that we started back with Tokyo 2020 and Beijing 2022 is social listening. And we're planning to continue this during the World Cup in order to quickly identify rumors, fake news, and address them through social media channels in this case, and make sure that we provide health advice needed for a safe and successful World Cup. So I think I'm stopping here and give you back the floor, Judith. Thanks, Evelyn.
Thank you. Excellent and great. A lot of experiences already from the big sporting events, although a little bit different because those were not with the spectators. So this is the first post-COVID event that we will have a large amount of spectators, I think. So having said that, I would also ask people who are our participants as well, if you have any questions, you can write your questions in Q&A. And we will also have some time if you want directly to ask our panelists. And with that note, and before I ask the question, Dr. Liviu Verdasco, I will just put together a short video for the simulation exercise that has been done. So bear with me. I will just share my screen and put that video. So thank you, Dr. Liviu, for providing us with this short video. And this gives the introduction to the question about how do we really prepare and what are some of the simulation activities that we do in order to prepare and to validate and enhance preparedness and response plans, procedures, and all systems for all hazards and capabilities. Can you tell us more how we supported our colleagues in Qatar, in this part of the activities? Thank you. Over to you.
Thank you. Thank you, Lubica. And very good to be here and see a lot of colleagues and friends. It's a very good question. And Amaya alluded to some of the elements, and I will drill in and zoom in a little bit more on simulation exercises and after action reviews. It is indeed absolutely necessary to test whatever plans we're putting in place. These plans, without being tested, they just remain that. They remain plans that may work or may not work. And it's also important to do this test so that we can go back to those plans and make necessary adjustments and changes so that things can get better next time around. One of the ways, and not the exclusive ways, but one of the ways of testing the plans are simulation exercises. There are many types of simulation exercises, and some people get scared of simulation exercises because they're thinking that, oh my God, we're going to be tested and we're going to see, and we try to relax people. This is a game. This is a useful game, but it is a game. And absolutely no need to stress out or to think about it as some sort of an audit of systems. It is not. It is for us to get around the table, or sometimes in field exercises, more elaborate exercises, more complex exercises, to make sure that whatever we anticipated, whatever we prepared for actually will work in an actual event. And sometimes certain elements of events only happen once, in many years, and we cannot wait until those things happen. We need to simulate them and anticipate them. That's why we do this, the simulation exercises. In a way, what happened in Qatar last year, which was, some of you may know, there were Arab Cup games organized last year at the end of last year, in a way that was some sort of a very full-scale, very large-scale field exercise. But sometimes we cannot organize something like that. And in those cases, we do a number of simulation exercises that yes, they do take some resources, but they're very useful and they have very great impact, and they don't take too many resources, so we don't have to be afraid of that. Now, specifically to your question of how we work together, it was a fantastic effort of 3 levels of WHO working with many parties in Qatar, which have great experience and expertise. We assisted first organizing a tabletop exercise last year before the Arab Cup. And then another exercise that you saw, a very short video clip that showed how we did the exercise in August in preparation for the World Cup. And as Dr. Rayana mentioned already, and I want to emphasize this again, that there is great capacity in Qatar, not only in Ministry of Health, but in other institutions and ministries for conducting simulation exercises and for having contingency plans in place. And this is one of the reasons, also as Dr. Rayana alluded to, this is one of the reasons that we partner with Qatar to develop some standards for conducting such simulation exercises in preparation for other sporting events, and not only sporting events, other mass gathering events in general. So we're very hopeful that a lot will come out of this that will be helpful for years to come, for many events around the world, for many governments and entities involved in preparations of this exercise. Another way of capturing lessons and making improvements to existing plans is what we call after-action reviews. Let me just make it more simple. What is after-action reviews? Basically, whenever an emergency happens, in this case, it's not emergency, it's an event, we respond, we manage. In this case, if it's an event, it's managed, it happens. Then you do, an analysis, what went well, what we learned, what didn't go so well, so that we can have some better systems in place next time. And in this regards, in March of this year, 2022, we partnered again with the Ministry of Health of Qatar to organize an after-action review of the games that happened last year, the Arab Cup. And one of the recommendations was to conduct another simulation exercise, and that simulation exercise was conducted in August. So all in all, I think these are very necessary elements, reviews, and simulation exercises. They are not so difficult to conduct, and they should become part of the fabric of public health emergency preparedness. So with this, I hand back to you, Lubica.
Thank you, Dr. Livio. And there are a couple of questions for you actually in Q&A session. I think it was interesting for all of us to learn more. What do we test? How do we test? How is that needed? So if you can maybe respond to some of those questions, it would be great. So having said that, now the question for, again, a dear colleague and friend, Dr. Dalia, coming as part, so from the regional perspective. So could you maybe share with us, as part of the planning and preparedness activities, how is the regional office supporting country to prepare healthcare sector for the major mass gathering event? And maybe what are some lessons learned now from the regional events? Because we know that the region is full of these mass events, maybe not sporting events, but a different type of events, and how can we apply those for Qatar preparation? Thank you. Over to Dr. Dalia.
Thank you so much, Lubica, and always nice to hear from you. And thank you so much for having me also part of this great webinar. Maybe just to highlight, before we talk about the mass gathering, that WHO has been always in place to support countries in so many different areas of work. And when it comes to public health events, I think we used the framework of the international health regulations as the one that guides our work when it comes to building capacities of countries to prevent, early detect, and respond to the different public health events. And we've been working with countries all along since those regulations came into force in 2007 in order to make sure that all the countries, we do have the capacities that are needed in place to respond, if you want to prevent and early detect and respond to different events that would be coming from the different sources. Not necessarily disease outbreaks, but it can go beyond those infectious components. Qatar, of course, is one of these countries that WHO has been working with since a long time ago. And if we look into these international health regulations, the focus is really broad in a way that we look into the surveillance capacities, we look into the diagnostics, we look into the human resources, we also look into the capacity to manage emergencies, the capacity of the health sector in terms of services, in terms of trained personnel, in terms of equipment. So it's a broad range of areas that we have been putting in place and supporting countries to make sure that we have those capacities that would really allow them or put them in a better preparedness situation. And if we take the mass gathering as one of the events that usually exposes the country to different hazards, given the fact that we have big number of people coming, visiting the country during short period of time, which may exhaust the system inside the countries to manage any situation that might be erupted during these mass gathering events. This by default means that we really need to work with the country to enhance the different existing capacities. So we're not coming with the new areas of work, but just to make sure that the existing capacities are being strengthened, are being enhanced in order for them to be able to adapt and cope with the situation where you have big number of people coming. And therefore, our support to Qatar, whether through the agreement or beyond the agreement, has really been going to look into the different areas, making sure that we have enhanced surveillance that will be able to detect any signals that may lead to events, making sure that we also have systems in place that are able to collect sentiments, concerns, questions from communities. And this should help us understand the situation, but it should also be used as a way to inform not only messaging, but also different public health measures that might be needed. We've also been working with the country to look into the mass casualties, the capacity to manage mass casualties if any situation happens or if there is any emergency. We've been doing a number of trainings related to this in order to make sure that the capacity exists. Having said that, we know that the capacity exists. So Qatar is one of the countries that we can safely say that we have strong capacities. WHO has been there to provide additional support to make sure that the situation is pretty much ready for this mass gathering event. Now, as part of the EMRO region, as you know, Eastern Mediterranean region, and we know that a number of mass gathering events have been taking place in the different areas or in the different countries, maybe with different magnitude or with different number of persons and with different number of countries participating. I think we can dwell on a number of areas that or lessons that we have learned so far. The most important part, which already been mentioned by Anaya, is the risk assessment. You can't really go ahead with any mass gathering event without performing risk assessment in order to make sure that you really understand what you're heading to, what kind of capacities you have, what kind of risks that you are expecting. And the risks pretty much are coming from a risk profile that the country would be able to identify. And this risk profile does not only look into the situation inside the country, but it really looks also into the situation of the countries that will be participating, the type of disease profile that we have, the type of hazards that might be happening, and therefore those might be imported once they are participating in this big event. So the risk assessment is an essence in order for us to be able to understand the situation, but also to put the mitigation measures that will be needed in the different areas of work. The second lesson that we've got is multi-sectoral coordination. In any single piece of work, in any emergency, in any situation that really needs a lot of work that should involve different sectors, multi-sectoral coordination is critical to make sure that we are all speaking the same language, we are all going in the right direction, we're all able to rationalize the use of resources, and we are absolutely not duplicating efforts. And WHO has been always advocating for this. And maybe take this opportunity just to talk about the Public Health Emergency Operations Center, which we know that it does exist in Qatar, and they are using it to bring the sectors together for the multi-sectoral coordination. And it's really great for someone who has visited the center, that actually a number of centers with the capacity exists. That's absolutely great to make sure that it's being utilized as a platform to provide the coordination between the different sectors. One more lesson, and again, I'm trying not to repeat all what have been said by Amaya and leave you, because I know that everybody is just coming out with great ideas. I'm really trying to find a way where we can capture other elements that have been coming out as lessons. The social listening, which means that it's important to understand that everything is coming from communities. They're the center of all pieces of work that we're doing. It's very important that we get to know that they're satisfied with the service that they are receiving. They are happy with the organization of the event. There is no problem. And even if there is any issue, anything, we are able to detect those sentiments, those comments as early as possible, because it will really help us to understand not only the situation, but also it should inform our decisions. And of course, inform the messaging that will be coming out to address different concerns and different situations. So making sure that we do have a system in place that regularly collects those insights, that is really essence, because based on those insights and analyzing those insights, we should be able to come out with range recommendations. And maybe the last part that I would focus on is the documentation. We are always after generating legacy. Legacy is just a must. And guess what? No matter what we do, we always tend to learn. If a situation is going on, and we all hope that we will have absolutely great and successful FIFA, there will be absolutely a lot of lessons that will be generated out of this. So making sure that we are documenting all of these lessons. We're really looking into the best practices. We're really looking into even the nitty-gritty details that would really help other countries that they will be organizing different mass gathering events to learn from these experiences. So having said that, we also know that a number of mass gathering events have been taking place. There has been a chance to collect some of the lessons learned, but the FIFA is a great event. And I don't think that we really need to miss this opportunity to put the things together that will be of help, not only for countries, but also for us who are supporting countries in moving forward, and particularly in building their preparedness for mass gathering events. We should also be able to take those lessons and put some strategic directions in moving forward. Thank you so much.
Sorry, thank you, Dr. Dalia. Thank you so much. A lot of lessons learned from the region and of course for globally. So we are seeing both perspectives, which is great. And then we are very, very happy to have Dr. Soha with us from the Ministry of Public Health from Qatar. And the question for her at this stage would be, well, how is Ministry of Public Health preparing to provide public health advice and guidance to the visitors on topics such as, vaccination, especially maybe COVID vaccination, food and water safety, what to do in case of feeling unwell, what are some of those advices that we are giving? And of course, what are some of the actions, because both Dalia and also Maya mentioned a lot of social listening and how do we talk to the communities. So how are we informing the local communities about action to prevent and mitigate any kind of outbreak that might happen, during an event like this? So over to you, Dr. Soha.
Good afternoon or good morning and good evening, depending on which part of the world the viewers or the participants are from. I'm glad to be part of this panel, and there are so many experts here. I'm a bit intimidated by you guys. I will apologize in advance. I'm having some technical issues, so if you see me freezing for a few seconds, I promise to be back on screen again. We've been working on the preparations for the FIFA World Cup since we were awarded the honor of hosting it in this year in 2022. And over the past year, and I think, Livio, you said it very well, that the Arab Cup was kind of a real-time drill for us on the kind of messaging, the preparations, how do we raise awareness, be it for the local community or for our visitors. So we've been working very closely since we were awarded, and even more intensely over the past year, and even more intensely over the past several weeks and months, on communication and cooperation between the Minister of Public Health, the various health sectors in the country, of course WHO, the FIFA itself, and the Supreme Committee for Delivery and Legacy, and plus many other partners that it's difficult to mention them all, on the kind of messaging, on our emphasis on making sure, or to our best ability, that this FIFA World Cup becomes one of the safest and healthiest tournaments ever. So the messaging that we are putting, we're using all possible means. So there are messages using mass media, newspapers, TV interviews. Even tonight, there's a program called Al Majlis, where experts from various sectors will be present to talk about messaging for the public. We're using newspapers, radio stations, programs. And since nowadays people depend on social media, so we're even using that, the various platforms, to raise awareness. And when we say raise awareness, it's about, for not just for the local community, it's also for the visitors, to ensure they are aware about what kind of health services are available in the state of Qatar. And what we've done is we've developed in the Ministry of Public Health a website for the fans. So if they need any kind of information about what kind of healthcare system is available in the state of Qatar, what pharmacies are available, what different hospitals and clinics are available, that's been made available for the fans, and that was shared with the FIFA. So the FIFA fan website also has the same information. Also, we are going to be, I'm not sure if it got announced or not yet, there's going to be a hotline. So people, when they arrive in Qatar, if they face an emergency, they can ask questions. And also, we raised awareness, and there are messages out there to tell people how to call our ambulance service, what kind of emergency services are available. And I'm happy to say that Haya card holders, so people who will be joining us for this event, can seek medical care in the government facilities free of charge, and those who have insurance can go to the private sector. As mentioned by all of my colleagues, Amaya, Dalia, and Livio, that we do have the capacity, we do have a strong health system in Qatar, and our messaging, it involves everything from communicable diseases, it has food safety, it has road safety, smoking, anything related to health, it's there in our messaging. Our emphasis on sport for health is very important to us, and that's in partnership with the WHO, of course. So all our partners are working very hard, and over the coming weeks, or not, well, I shouldn't say weeks, we're almost there to say days to the launch of the FIFA World Cup, that will intensify, and people will see more and more messages. And when it comes, I think I froze a little bit, and I think you mentioned something about the vaccinations. So we did make sure that our announcements about travel requirements to the state of Qatar is announced to all, wherever they're coming from. There will not be any entry vaccine requirements, including the COVID vaccine, but we do highly encourage people to be up to date with their COVID-19 vaccines, and plus their seasonal influenza vaccine, for example, especially that it is winter season, and this is, I think, the first time that we're having the FIFA World Cup in such a season. So we do highly encourage people. So it's not mandatory, but it is encouraged, and that was also announced. So all the information that people will need, whether on what's required to enter the state of Qatar, or the services available in the state of Qatar, what to do in the case of an emergency, they can easily find that on the FAN's website, on the Ministry of Public Health, the FAN website, on the FIFA, on our social media platforms, so Instagram, Twitter, Facebook, all our websites have that as well. And we are participating in webinars like this. We did that several times before, and this one, especially to highlight these points and tell people, we will try our best not to only make sure you enjoy the tournament, enjoy all the side activities we're going to have, but also be healthy and safe during the event. Thank you.
Thank you, Dr. Soha. Actually, there was one question about that you already answered about raising awareness about influenza vaccination to the travelers. And yeah, because the north part of the world is entering into influenza season. So we are also encouraging everyone to get the influenza vaccine. Having said that, maybe we can go to there is an interesting question that was also in the chat and Q&A, and we got it through the email, is more about, maybe this could go to Dali and maybe Amaya, and of course, whoever wants to jump in, is most that we have seen lately major events and the mass casualties, and Dalia already mentioned, like in the last weekend in Seoul, you have all seen what happened, and previously in some football matches, especially in Indonesia. Will there be any safe inductions or specific communication, let's say, when entering to the stadiums or during, you know, the gatherings outside of the stadiums, because there will be a lot of gatherings. So what are some strategies to prevent this kind of incidents? Anyone who
I can do the part on the mass casualties, but I'm sure Dr. Soha can allude more on the instructions and advices that has been given to passengers and those who will be participating in the event. So as I mentioned, I mean, after doing the evaluation of the medical services that are currently provided in the different health facilities, which were absolutely great to look into, we realized that a training on mass casualty management was needed, trauma care, etc. The country has a lot of capacities when it comes to this area. So our training, I wouldn't say that it did not add a lot. I mean, of course, it was of an added value, but we also understand that there is a lot of capacities on the ground. We do hope that such situation does not happen. But at least from the training that we have provided and from the interaction that we have been having with different sectors and facilities, we understand that capacity is there. It does exist in terms of the capacity to manage the number of casualties that may result from any incident. And having said that, this includes the on-site management, it includes the referral system. This includes the in-hospital care. This includes the identification of the different hospitals that will be providing the different services, but also the type of services that will be provided inside those health facilities. The workforce that are trained and providing the different type of services, including critical care, and if any need for rehabilitation as well. I mean, as a pathway for providing services in terms of emergency, it's pretty much clear, identified, and is in place. And I leave it to Dr. Saha to talk about the instructions that were given to participants.
Thank you, Dalia. Actually, when we said, or when I said earlier that there was a lot of preparation, I think from day one when we were awarded, and that was escalated as time became closer, and of course at this moment it included the safety and the well-being of those attending, be it from visitors from outside.
I think we
or the local community, and there are events that occurred. I think I froze. I was saying that we were prepared for this for a long time, and part of the preparations is the safety and well-being in such a mass gathering. And yes, there were events that happened recently in other countries where there were injuries and there were casualties. So of course we bear that in mind. And when we spoke about exercises, simulation exercises, drills, they were not only health related. So there were drills about food safety, there were drills about communicable diseases, but there were also drills about extreme weather, about accidents, how would we respond, how would we react? And for these exercises, it involved literally almost all entities in the state of Qatar. And the most recent major exercise was Al-Watan exercise, which involved everybody from Ministry of Interior, Ministry of Health, FIFA, WHO, so name it, they were involved, emergency, the hospitals, everybody was involved, bearing in mind different scenarios and all possibilities. Surprises happen, but we are prepared as much as humanly possible for such events. One of the things that I think is a bit unique about our stadiums is that when you get to your tickets, it's very clear about the gate you're supposed to use and where your seats are. And basically that's to avoid people using the same door and crowding. Where are there other entrances for years? There are security staff who will usher them and direct them towards their own entrances. There will be crowds, but it will be minimized. So we've got a huge number of volunteers continuously being trained, even as we speak, on how to handle, if God forbid, any emergency happens, to help people to exit the stadiums. There are ambulances on site, there are paramedics on site, there are physicians on site, nurses. Our own public health team will be present in each and every stadium all through the tournament. So the preparations are there. And as I said, we're looking forward for it to be one of the healthiest and safest tournaments ever. Thank you.
Thank you, Dr. Soha. And maybe I would like to call on Amaya, maybe from the mass gathering perspective, anything that you would like to add here, please?
Sure, thanks a lot, Yubi. And I think that is mainly everything is being covered, but we know very well that experience has shown that the right crowd management strategies can greatly reduce the risk of the events ending in a bad experience. Incident site plans and procedures for access and crowd management are integral parts of the planning process. Back to the risk assessment. Risk assessment is needed not just for health, but only for safety events. This is really key, making sure that all stakeholders are around the table, and this very much includes law enforcement and security forces in this case, to identify these potential dangers and plan how to keep people away from these dangers. A key factor, of course, as Dr. Soha mentioned, is to assess the venues and tailor the needs to this specific venue. So then you can start thinking about how people are going to move around. Once you have an idea that who will be attending, when is it happening, back to the venues where it's going to be happening, you can start contacting the key people that will be involved about this crowd and how to manage the crowd, and making sure that you contact, for example, emergency services, as Dr. Soha mentioned, the event contractors, local authorities, and even neighboring businesses as well. But again, as Soha mentioned, things can always go wrong as well, no matter how meticulously you plan for the event. And therefore, you should always have these contingency plannings when these things might happen. I mean, it could be related to sudden changes in the weather, a fire, a flight that might break between fans, or as previously you mentioned as well, an stampede such as the unlucky one in Indonesia. All the recommendations are more practical. Make sure that you demarcate and differentiate areas, so make sure that the attendees can find the way around the venues, and they know where to go. Screen the attendees, streamline check-in and check-out to reduce the queues, and make sure that you have you place the staff strategically around the venue, and make sure that you cover the key areas such as the entrance and the exits as well. And of course, as previously mentioned by colleagues, have the key number and the right number of people and the staff and security personnel, as well as train them. And they were already mentioned about this mass casualty management training that took place back in March, and also the work that we've been doing with emergency medical teams in Qatar. So make sure that everybody is ready for the worst case scenario. Thank you. Over to you.
Thank you, Maya. There is a very interesting question, and maybe I would like to ask Liviu and also I would like Dr. Rayana, maybe your perspective, and how do we prepare actually for this kind of event for the physically challenged people during the event? Do we also test that, for the scenarios when we do the testing, for people with the physical disabilities, if they want to attend, because obviously want to attend, and then what are some of the issues and how do we treat that? So maybe over to Liviu. Dr. Rihanna, please jump in when you would like to say, comment something. So yes, first to Liviu, I would maybe to hear how do we also incorporate that in simulation exercises?
Sure. I think specific aspects like this can be and should be included in simulation exercises. And if this issue is highlighted as something very probable or very important in particular context, then a specific drill specially designed for this could be organized with needs of people with disabilities in mind. So absolutely.
Yes, there was an also, yes, Dr. Soha, please go ahead.
Yeah, if I may just also add to that actually through our Qatar Foundation colleagues, there are even catering for those who have visual or hearing impairment, so they can experience the event at the same time. So this has been catered for, plus even the stadiums themselves. I would just like to highlight this. There are special seating for people with disabilities, and even seats next to them for their, companions, colleagues, whoever they are, arranged very well, to the extent, like anywhere in the world, between the main gate entrance to the actual stadium, there's a walk. There's quite a walk for people to go through. So there are actually cart vehicles prepared for the physically enabled to take them from the gates all the way to the designated gate for their seats. So we did consider the people with any kind of physical or whatever disabilities, and we tried our best to make sure everybody gets to experience the joy of the FIFA World Cup. I just wanted to highlight that. Thank you.
Thank you, Dr. Soha. Over to Dr. Dalia.
Checking. Rayana, would you like to say anything before I jump in?
Yes.
I just wanted to compliment that there had been also a lot of efforts, not only around the stadium, but also in the transport and in the accessibility in the metro and so on. Plus, of course, what Dr. Soha has mentioned, whether it is for blind people or for people in wheelchairs or even having other kind of disabilities. And I mentioned in the chat that there is also more than 20,000 volunteers that have been mobilized and also trained on accompanying not only the fans but also specific categories. And in this respect, of course, there will be also the appropriate messaging to those who need it in the way and in the format that it would be needed as as we go along. Over to you, and thank you, Dalia. Thank you, colleagues. I am enjoying the experts discussions and so I hand over to you, Dalia. Over.
Just a couple of points from my side, Lupita. In situation when we really have emergencies, time is really the critical factor in the middle, which means that we tend to lose a lot by time, and therefore our response has really to be very quick. Not only to manage the situation, but also to prevent exacerbating the situation if the response would be a little bit delayed. And one of the things that usually countries do, and particularly Qatar did that, running different simulation exercises, usually they come by different scenarios, in a way that you expect different type of scenarios, and the magnitude of impact will be different according to these scenarios, and making sure that you have add this in your plan. I would stress on the fact that the standard operating procedures are very important, which means that if anything happens, then the flow of information, how does it go? Who will be reporting to whom? What exactly the first action needs to be taken? How the other sectors will be coordinating with each other? And this really takes us back to the point that multi-sectoral coordination is important in every single aspect, and particularly when you're having an emergency, making sure that you're receiving signals as soon as possible, transmitting those information or about these signals among the different stakeholders is important. Running the risk assessment in order to be able to decide on the spot what is exactly that needs to be done, but also, of course, making sure that each sector understands and knows the roles and responsibilities, which again we've seen in running those exercises in Qatar and looking into their plans. It seems that everything is already in place. I think one of the failures that we may see in other situations is that if the plans are not tested, then the plans may not function during emergencies. And that's why it's important to test them. So when, la samahallah, God forbid, if there is something we know that our plans are perfectly well, everybody knows what they need to do, roles and responsibilities are identified and able to manage the situation as rapidly as possible. Thank you.
Thank you, Dr. Dalia. I would maybe go back just a question about surveillance, because I've seen there are a couple of questions in the chat. Well, thank you so much, everyone, for many questions that we are receiving. I'm trying to put together. So maybe to Dr. Soha and whoever again wants to jump in, maybe under surveillance, how the surveillance is going to be enhanced, you know, if there is epidemiological surveillance and in general. How are the preparedness, what is the preparedness side of that work as well, if you can? And there are, of course, a question about, will we document all this? Will we document at some point, you know, and have the lessons learned? Of course, we hope after the World Cup to have a similar webinar and then talk about, you know, this is what we had before and this is what we had after at some point. But we are sure that all our colleagues will be working on many experiences that will come out of this. Over to you, Dr. Soha, and again, whoever would like to say something about the surveillance for the World Cup.
Yeah, thank you very much. Yes, surveillance is a very important component of our public health activities in general, regardless of the FIFA World Cup. But of course, in preparation, when it came to the Arab Cup that we had in December 2021, or now with the FIFA, that of course was intensified and further enhanced. So we do have very strict policies when it comes to surveillance, definition of diseases, notifiable diseases. This is all shared with all healthcare facilities, being governmental, private, semi-governmental. And this was further enhanced now for the FIFA World Cup. One of the things, I'm not sure if we say benefited during the COVID-19, but right at the beginning of the COVID-19 pandemic, our software for surveillance was launched. It was meant to be launched anyways, but it got launched with the COVID-19. And what this software does, it's an automated way of reporting. So the minute a health provider anywhere in Qatar puts a diagnosis of a communicable disease, even if it's only suspected, it will immediately reach us in the Ministry of Public Health. We will immediately initiate our first response and investigation. And if it's confirmed, then we move to the next step of whatever is required depending on the disease. And of course, we have focal people assigned for each communicable disease, and they would be fully investigating it. We even have a response for such diseases. For example, let's say there's a measles case reported. We will go to the extent of identifying the contacts of that person, check their vaccination status, if they require a booster dose. So that's all part of our plans already, and this was intensified for the FIFA World Cup and any major event, to be honest. Our surveillance system is a combination of active, passive, event-based. We're using international tools, intelligence tools. And when we say surveillance, we're not only monitoring the situation in the state of Qatar, we're also monitoring it globally. So if there is an outbreak in any country, especially participating countries, or I can't say just participating because it's the entire world. So any outbreak anywhere in the world, we're on top of that. We monitor the situation and we're ready with our reactive measures to protect the state and make sure, again, it's a healthy, safe tournament. So we have very strong surveillance tool. We have a big surveillance team. It's part of the Health Protection and CDC department within the Ministry of Health. And we work together with the section, which is the vaccination, which is under my leadership. We have the disease control under my colleagues' leadership. And we work very closely with our partners, especially the government sector. So that's Hamad Medical Corporation, primary healthcare, on especially reporting. Reporting is to us is mandatory. So it's not an option where people or doctors get to report or not. So that's there. And for the FIFA World Cup, as an added step, we did training. So basically, we refreshed the training for our healthcare providers, and we focused even more on the health providers or the healthcare workers who will be situated in the stadiums, in fan zones, and all these areas. There are clinics going to be available in many of the hotels. So even these staff were trained. They were given the guidelines, the case definitions, the reporting. We even expect them to send us daily zero reports. So even if they have nothing to report, they need to report that as well. So we've been working very hard on that. And as we said before, we're as ready as we can be, as humanly possible. All the resources have been put forward, and we hope for no major incidents to occur. Thank you.
Thank you. Over to Dalia. Would you like to add something?
Yes, yes, but of course I just need to say a word before I give an answer. I'm just very much thrilled the way you speak, Dr. Saha, how much you're passionate about all these preparations. It's absolutely fabulous, very beautiful. And it really reflects the trust and the confidence of what's been going on. And we do all hope that this is absolutely going to be a very successful event. Maybe just to add a couple of points on the surveillance, and Dr. Soha beautifully described what's going on. Qatar also is one of the very few countries that managed to establish event-based surveillance, and which goes beyond the health facilities, because we're looking into all hazard surveillance, usually with the indicator-based surveillance that goes with the case definition, pretty much focused around diseases. Event-based surveillance has been established in the country for quite some time now, and it's been ongoing in a way that this surveillance is not focused on the health sector. It goes beyond the health, it's health and non-health, and the whole idea is really to identify sources of contaminations or infections or sources of emergencies. On the top of that, with the support of WHO, we also managed to establish the Epidemic Intelligence Open Source, which is an application or a tool that has been put in place to do a scanning of media by using some keywords that will focus the scanning in order to identify signals. And those signals usually go through the process of triage, verification, in order to be able to identify events as soon as possible. And of course, a team has already been in place and trained to do the investigation for any signal, and hopefully to prevent any event from happening or respond to it as rapidly as possible. And when we talk about signals, it's not only signals, again, related to diseases, it can go beyond. The whole idea is really to make sure that we are able to early detect those signals, and the system is in place. The country has done a number of trainings and agreed on regularity of producing reports, hopefully daily reports, to look into these signals, with a channel of information sharing and reporting is already in place. Thank you.
Thank you. Over to Dr. Soha, maybe for a final comment, and then I would really like to call on Dr. Rayana. Maybe we start wrapping up this webinar. So over to Dr. Soha.
Just a small comment that I missed earlier when I was speaking about surveillance, is that I spoke mostly about diseases, but I would like to also emphasize that we also have environmental surveillance. So there are air sensors placed in various locations, including some of the stadiums. We're even having surveillance for for the water and the wastewater and all of that. Not just, I think I'm back. I froze for a second and I'm back. So I was just saying that not just disease surveillance, we're also having environmental. So that's air surveillance. So air sensors are available in various areas to catch any possible hazard. We're doing water and wastewater surveillance to also identify any other possible hazards. So I just wanted to add these points as well. Thank you.
Thank you. Well, maybe Dr. Liviu, would you like to add something, please? And then
No, I think important points made. Congratulations again to everyone, and for more to come. I think one thing that was mentioned by some, which is already in sort of discussions, is how are we going to capture lessons learned? So similar to how the Arab Cup after action report was conducted, we are very much hoping that something similar to that or greater than that will happen, and we are happy at all levels of WHO to support as needed the government of Qatar.
Thank you, Dr. Levy. We are already exactly in an hour of this webinar. In order, I see that there are many questions, and I'm really sorry we cannot answer those. You see, the interest is huge, and I'm really thankful to everyone to connect it. And I would really like to give the last minute, 2 minutes, few minutes to Dr. Ayana to wrap up this webinar. And huge thanks to all of you. Over to Dr. Ayana.
Thank you very much, all colleagues, and I really think that we covered a lot of topics from the process of how we started working with Qatar and preparing, testing the plans, piloting the tools introduced, but also working with them on adopting a lot of new areas for facilitating a healthy, safe, and enjoyable at the same time mass gathering. I wanted just to comment that the responsibility is shared, and it's shared on everybody. So it starts also with the individual and with every person, that if a person is sick, it is preferable also not to go and maybe sit in the middle of a match, or to also not to take care of people around him or her, and make sure that everybody is at least aware that we even don't want people sneezing. So, but I can't stop, some of those microbes and viruses from flying around. So it is important to contribute from all aspects, from the Qatari Ministry of Public Health and authorities and all the stakeholders, including the FIFA planners and organizers, and from our team in WHO. We are hopeful for, and we are, I think, looking forward to not only to have a successful and safe World Cup, but also to make sure that we share later on with other organizers of similar events, or even bigger, or even maybe less important, but at least the lessons of how it was well done and it was prepared. And inshallah, everything will go as per plan and for the safety of all. So I thank you very much. I really congratulate all the colleagues, and we take it with a lot of hope and wishes for success. Over to you.
Thank you, Dr. Ayana. Thank you, Dr. Soha. Thank you, Dr. Dalia. Thank you, Amaya. Well, Dr. Liviu left. Thank you to the EPI-WIN team and HQ for this webinar. We are looking forward to having another one sometime after the World Cup, and then talk about all these lessons learned and how this can be applied again for the future events. Thank you very much. Have an excellent afternoon, and well, let the best team win at the World Cup
and score for health.
Exactly. So let's the health team win. Bye all. Thank you.
Thanks a lot. Bye. Bye.
Thank you so much. Bye-bye.
Bye.